Hi there. I would like to welcome to this talk on psychology research strength. I'm Shamsul Haque, Associate Professor in the Department of Psychology, Jeffrey Chia School of Medicine and Health Sciences at Monash University, Malaysia. I have a PhD from the University of Bristol in England. My research interest covers autobiographical memory, identity, and mental health. I have published 50 over papers in leading psychology journals and several book chapters in edited volumes. I have published my papers that have been cited more than 3,000 times by now. Now I would like to take you through our research activities in the Department of Psychology. So in the department, we have three research groups. The first one is social and cross-cultural psychology. The second one is health, addiction, and counseling. And third one is memory and cognition. So let us now talk about the projects that we are currently running and the projects that are upcoming. So current projects, we have 4 current projects. The first one is neural markers of age-related decline in cognitive function. So this project has been funded by the Ministry of Higher Education in Malaysia. This project has attracted a very large grant. The second project is the effects of light spectrum on human cognition and alertness. So this is an industry-funded project. We are collaborating with the School of Engineering. So we are looking at how human cognition and alertness are affected by different types of light with different intensity. The third project is trauma, memory, and mental health among refugee populations. So we are basically focusing on Rohingya refugee populations who are now living in Malaysia and Bangladesh. The fourth one is health beliefs among indigenous people. So we have several upcoming projects: attention, memory, and executive control, health knowledge, belief, and lifestyle, drug abuse, treatment, and relapse, sleep and autism spectrum disorders, and finally, interpersonal perceptions in sexual relationships. Let us now talk about the impact of our research. We see that our research has significant impact on addressing different issues faced by the individual, family, and society at large. For example, our project on drug addiction. So drug addiction has been a global pandemic in the recent decades. Millions of people are suffering from this problem across the world, from highly developed nations to the least developed countries. We need to find ways how to better address the addiction problem at the personal level, family level, and the societal level. We need to develop effective behavior change and therapeutic intervention models to combat this pandemic. So that's our project impact, the project we are talking about, the drug addiction. The second project, trauma and mental health among refugee populations, how this project can impact the community. We know that the number of refugee people around the world is increasing every day. These are the people who have fled their ancestral homes due to war and persecution. Many of them have been exposed to different types of traumatic experiences, such as killing, burning, abduction, rape, and physical torture. Because of those traumatic experiences, their mental health and everyday functioning has been affected. Our research would shed light on how we could reorganize their life narratives or their life experiences and offer hopes for the future so that their mental health could be improved and they lead a more meaningful life. So the third project on indigenous communities, how that can impact their life and their health. We know that indigenous people have their own health beliefs and practices, and they have been practicing their traditional healthcare facilities for hundreds of years. If we want to promote their health, both physical and mental, we should integrate the mainstream healthcare system with their traditional health practices, because they don't want to give up their traditional health beliefs and practices. So our research would explore the core health-related beliefs and practices among these populations and their attitude towards the mainstream healthcare system. So you see that the kind of research we are conducting in the department is very important. And we have adequate lab facilities with necessary psychometric tools and sophisticated instruments like EEG. We would like to welcome you to our research team, conduct your research at the postgraduate level, and take up the challenge to better understand people and the society in which they live. So together, we believe we are able to make a difference. Thank you very much.